Hello and welcome to this lecture. Today we are going to discuss cerebrospinal meningitis, and I'm going to present a case. A Jane is a pediatric hematology nurse who come into the pharmacy asking to buy paracetamol. She say she has a terrible headache and upset stomach. She seems confused and disoriented. Talking to her future Talking to her further highlights that something is not right. Jane explains that she has not felt well since last night and has spent most of the day in bed as she feels like she has no energy. However, some of what Jane also said does not make sense. She is finding it hard to follow the conversation. She has no fever or rashes. Vomiting, severe headache, and confusions are all symptoms of meningitis. Using the symptom checker, such as one by the Meningitis Research Foundation, to help the decision making. Upon further questioning, it is clear that Jane must go to hospital immediately, and an ambulance is called. Jane presented with confusion, disorientation, which might indicate a stroke. However, bacterial meningitis can cause stroke. So, the cerebrospinal meningitis is an inflammatory process caused by the infection responsible for meningitis. So, the morphology consists of the meningeal vessels are swelling and prominent. Pus can be followed along the blood vessels on the brain surface. Inflammatory cells infiltrate along the walls of the leptomeningeal veins. And inflammation may extend to ventricles and produce ventriculitis. On microscopic examination reveals the presence of neutrophils abscess in the brain. So when we see the morphological characteristic, they are more talking about the inflammatory mediators, and the inflammatory mediators like neutrophils will be found. Then obviously inflammation occur, that infiltrate into the wall, especially in the leptomeningeal veins, and that can extend to ventricles and can cause ventriculitis. And I discussed before as well that the suffix like itis, wherever this suffix come, it means that inflammation, there will be the inflammation. So ventriculitis is the inflammation in the ventricles. Then the presence of the neutrophils or abscess will be formed, and then we also mentioned that will be the presence of the pus followed along the blood vessels in the brain surface. So what I mentioned that leptomeningeal veins, and they also affecting, like you can see that the arachnoid matters and subarachnoid spaces. And this is a structure actually for meninges that consist of superior sagittal sinuses, arachnoid granulation, and dura mater. We already discussed this thing in the anatomy, so I'm just presenting this picture for the revision. And these round structures is showing you the presence of the abscess formation because of the infection, and that is responsible for the inflammation. These are the meningeal veins that showing you that is inflamed, and that inflammation is responsible for the because of the infection that produce that effect. So we can see that the main thing is that the meningeal vessels are prominent and swell. So these meningeal veins, and they become swelling, and that because of that swelling and inflammation, and the neutrophil will be found over there. So actually they are affecting the meninges in the brain. That is the main thing. So thank you so much for this lecture. Hope to see you again.